In the second part to Chapter 14 of Special Populations, we will focus on immunological conditions. When a pathogen has entered and adversely affects the body, sometimes the immune system cannot destroy the pathogen. Also, diseases can cause the athlete's body to attack itself. These diseases are called autoimmune diseases. In either case, individuals with these conditions can participate in physical activity and exercise, which can hopefully make them stronger and attempt to fight off these pathogens and promote a healthy lifestyle. The first immunological condition we will talk about is chronic fatigue syndrome. Chronic fatigue syndrome, or CFS, is a condition that affects mostly middle-aged women. The athlete who has chronic fatigue syndrome is continually tired, which interferes with activities of daily living. They also have headaches, sore throat, low-grade fever, difficulty concentrating, confusion, and memory loss. Rest typically does not relieve these symptoms. The condition is not caused by illness or disease, and although no specific cause of CFS has been determined, we know that the immune system is not properly working. No cure exists for CFS, but the symptoms of depression and mental anguish can be treated. When we look at chronic fatigue syndrome, exercise has been shown to be a valuable treatment for individuals. Although exercise does not dramatically improve the athlete's physical capabilities, exercise has been shown to significantly affect positive changes by increasing their perceived quality of life. Mild graded physical activity benefits the athlete with chronic fatigue syndrome. We need to have the athlete begin with low intensity and duration of aerobic strength training, flexibility, and functional exercises as any able-bodied athlete would. However, the athlete with CFS may not be able to progress as quickly. Completion of moderate intensity exercises is a primary goal. An athlete with CFS may not be able to tolerate the high intensity exercises due to their condition. Throughout this time working with an athlete, we need to explain that the post-exercise fatigue of starting an exercise program will decrease over time as exercise sessions are continued. As said before, our goal is to complete a moderate intensity exercise program. During this time, we need to discuss how the athlete feels, and we need to determine the time of day that the athlete feels least fatigued so that we can schedule the time for exercise during this time. Overall, the athlete should exercise 3 to 5 days per week. The session should be of short duration at first with simple activities. The athlete can work up to 1-hour sessions per day. Do not be concerned with progressing the athlete's intensity. The athlete's rate of perceived exertion dictates when to increase the time and frequency of exercise. An RPE of approximately 9 to 12 is the goal for each exercise session. If you're not familiar with rate of perceived exertion is the athlete's opinion of how hard he or she is working during exercise. This is part of a principle developed by Gunnar Borg, a Swedish psychologist. As you can see here, it goes from 6, no exertion at all the way to 20, which is maximum exertion. Our second immunological condition that we will look at is fibromyalgia. Fibromyalgia is a chronic condition that most often affects middle-aged women. The condition causes joint pain and stiffness as well as inflexibility and contracture of soft tissues. There's no specific cause for the condition. However, the condition has been associated with chronic fatigue syndrome as well as symptoms of anxiety, depression, and sleep disturbances. Exercise can be very beneficial for adults with this condition because exercise can decrease pain and joint stiffness while increasing muscle and tendon flexibility. Exercise facilitates the decrease of depression and anxiety symptoms by giving social interaction and a sense of personal control for these individuals. Typically, adult athletes with fibromyalgia are more hesitant to exercise than are normal adults due to fear of increased pain. These athletes often state that cold or hot environments exacerbate their symptoms as well. Therefore, it is important that we know the environment that these individuals are working out in. We also need to minimize any movements or exercises, including eccentric activity, that can increase the athlete's symptoms. We need to move very slowly due to physical and psychological considerations. Overall, the athlete should begin with 20 minutes of exercise 2 days per week. The athlete can work toward completing 40-minute exercise sessions 3 days per week. The exercise program must move, again, very slowly for these adults in order to address the athlete's physical and psychological conditions. The functional activities that the athlete includes in the program should mimic those of their activities of daily living. Now we will move on to metabolic conditions. Metabolic conditions develop when the body's normal metabolism is disrupted by abnormal chemical reactions, including decreased or loss of vital organ function. Our first one is diabetes. We previously discussed diabetes, but let's review it again in this section. Diabetes is a disease in which high levels of sugar persist in the blood. There are 3 common types of diabetes. There is type 1, type 2, and gestational diabetes. Type 1 diabetes is also called insulin-dependent diabetes. This form of diabetes often is diagnosed in children. The beta cells in the pancreas produce little or no insulin. Therefore, the glucose remains and builds up in the bloodstream instead of moving into the cells. The athlete with type 1 diabetes may experience thirst, hunger, unexplained weight loss, sensation deficiencies, blurred vision, and diabetic ketoacidosis. Type 2 diabetes is also referred to as non-insulin dependent diabetes. This is the most common type of diabetes and mostly affects adults. Adults and children with type 2 diabetes cannot utilize insulin properly, so sugar builds up in the bloodstream. Individuals with type 2 diabetes have similar signs and symptoms as individuals with type 1 diabetes. Athletes who are predisposed to type 2 diabetes are obese, sedentary older adults who have poor diets. Lastly, we have gestational diabetes. Gestational diabetes occurs when hormones produced during pregnancy block the utilization of insulin. Signs and symptoms of gestational diabetes are most often mild, but the woman can have similar signs and symptoms as type 1 diabetes. Exercise benefits an increased insulin sensitivity, a decrease in body fat, and an increase in cardiovascular health for all types of diabetes. A type 2 diabetic can have decreased blood glucose levels with exercise, but this decrease does not readily occur with type 2 diabetes. When the athlete exercises, he or she utilizes glucose as an energy source. The athlete must have simple carbohydrate snack available during exercise and make sure that they are measuring their blood glucose levels before and after exercise. He or she should not exercise if his or her blood glucose is over 250 or below 70 milligrams per deciliter. Those individuals with diabetes can perform aerobic and anaerobic activities at levels that an athlete without diabetes would, utilizing the FIT principle. We can also use strength training activities that focus on muscular endurance training with low resistance and high repetitions for these individuals. Diabetic individuals have progressively poor circulation in their extremities. Consequently, the athlete needs to wear properly fitted cushioning sneakers during exercise to protect the feet when weight bearing. Lastly, we will look at obesity. Obesity is an excessive amount of body fat. It typically is defined as an adult that has a body mass index or BMI over 30. Obesity detrimentally affects the individual's health due to numerous factors. One of these factors is that obese individuals are usually physically inactive. Fortunately, even a small amount of physical activity can help these individuals. Along with caloric modification, obese individuals who are physically active and perform exercise can lose body fat, which leads to weight reduction. If an athlete exercises regularly, his energy expenditure increases, which promotes weight loss. Weight reduction can also eliminate many other conditions that an obese individual may have, and also may promote a healthy lifestyle. However, before beginning a program for those that are obese, communication needs to be discussed between the athlete and the physician to determine if the athlete has any condition that may affect their ability to exercise. Depending on the inactivity and weight, lower extremity activities may need to include both weight-bearing and non-weight-bearing exercises. At the beginning of an exercise program for an obese individual, we should incorporate simple exercises such as active range of motion, gentle stretching, and isometric activities into the program and progress the athlete as tolerated. The athlete can obtain optimal effects with 5 to 6 days of exercise per week. However, we need to make sure that we only progress the athlete as tolerated. With these individuals, motivation is key. Motivation is key for the exercise program to be successful. The athlete will be more motivated and compliant if they see progress with their program. These individuals must also continually hydrate before, during, and after exercise because of lot of water through sweat from increased body heat production. They should also wear clothing that allows sweat to dissipate from the body and exercise in cooler environments.